So let's say you're planning on getting a surgery on your knee really soon, and you need to know what exercises you can and should do at the very beginning. So listen up, because I'm going to give you 4 simple exercises you can do, in many cases right after the surgery as well. So really quick, before we get going, I highly suggest that you guys subscribe to Riley Rehab on YouTube, because every single day I'm going to be making new videos in order to help you recover from your injuries or become more healthy and just overall live a better life. So with that being said, I'm going to explain to you the whole idea with the knee surgery. And I want to stress at first that you do want to listen to what your surgeon or your healthcare provider is telling you, because it really does depend for everybody. But I'd say in many, if not most cases, the exercises you do at the beginning are pretty similar, and they all involve the general thing of trying to get that range of motion. The idea with this is, as soon as you get the knee cut, there's a lot of stuff, a lot of scar tissue that will come that will eventually fuse your joint and stop it from being able to bend. So you got to fight against that, especially in the first few weeks. First exercise is you're going to imagine, slide your hand underneath your knee. You likely will feel a gap. In this case, you want to close that gap. So you want to press your knee down, the back of your knee down, into the bed, like that. Hold it for 2 seconds, and then relax. Press it down again, hold it, and relax. This will be painful, guys. I'd love to say it won't be, but honestly, it's one of those things you just have to deal with, unfortunately. And you repeat this. Really depends on how you are, but if I was to give a hard number, I'd say do it 10 times, 3 times a day, every single day. Second exercise. So that one was focusing a lot on helping you get your knee straight. The second one is going to help you focus on getting your knee bent. And all you need here is, you can take a grocery bag or any kind of garbage bag and wrap it and tie it around your foot. This is really key to do, and you can get somebody else to do this for you if you can't reach. But what this will do is this will help your legs slide for this next exercise. You also want to grab a towel, which you can wrap behind your knee here. And then what you're going to proceed to do is you're going to pull on the towel to lift your leg up while trying to bend your leg and slide your heel back. Once again, this probably will be painful, but I want you to push it all the way to the end of where you feel the most you can go is. Hold that for a couple seconds and then let off and go forward. You don't have to go all the way forward on this. You can just go a little bit forward and then you can come back up, because the real magic here is what you're trying to get at that end of range, at that point where you feel like you can't go any further. So go up and down on this one. And really on these, make sure you breathe. I think that's another point a lot of people miss, is when they do these kind of exercises. When you're in that much pain, when you're in that 10 out of 10 pain, which sometimes you can have with this, you're not going to be thinking straight. So this is why I really encourage you, once you get the motion down, to just make sure you're breathing all the time, especially during the painful points, like at this very top part. This one, I'd stick with the same thing, do 3 sets of 10 every single day. And those are the 2 you can do while you're in bed or on a couch. The third and fourth exercises are going to be while you're sitting, and you can keep this bag on your foot here. You could also use a sock if you want as well. As long as you get a good slippery surface, you're good to go. This next one, what you're going to do is you're going to bring your leg forward. Actually, you're going to get your bum to the edge of the seat first. Then you're going to slide your leg forward like this, as far forward as you can. You can also, and I actually would recommend, to keep your hand on the top of your leg and give it a little push down, just to get it as close to that end point as possible. You don't have to have both hands on, one hand is okay, but you really do want to push through there, because remember, you're trying to stop that knee from permanently being stuck. You want to get that thing bending as quickly as you can. Push there, hold for 2 seconds, then let go. Push there, trying to slide your heel forward, and let go. And push down. Don't forget to breathe and let go. This is the third exercise, and this one can often be very painful as well, just like them all, but remember, it's all about the end goal. In the end, when you're walking with an amazing knee, your body will thank you. The fourth exercise, I moved into a chair here just to make a point. You want to slide your leg back, and I actually prefer a chair like this over a couch, because you can really get it back as far as possible. you're going to keep yourself sitting at the edge of the seat here, and you're going to bring your leg back, just sliding it back here. Now most people would probably get to about this point and they'd feel pain. Hold it there for a couple seconds and then come back. If you're feeling okay with this, especially once you can get to the point where you're about here, I would encourage you to use your other leg, and I'm going to turn here a bit so you can see. Use your other leg to push that leg back. Hold it for a couple seconds and then let go. So those are the 4 exercises. You want to do these every single day, and really remember, it's all about the end destination with this. You want to make sure that everything in your knee recovers well. Obviously talk with your surgeon first and also make sure there isn't any other complications going on. But I will say that statistically speaking, it's going to be a painful process.